Hello, good evening, and welcome back. So, the transition begins. Coronavirus. Cover faces in some public areas, people in England told. The basic idea is that if you think you're at risk, then wear a face mask. If you read the entire report, then what it comes down to is basically common sense stuff. If you don't have to mingle with a load of people, don't mingle with a load of people. If you can keep your distance, then keep your distance. If you want to wear a mask, then wear a mask. If you think that you're infected, self-isolate. If it gets worse, call the NHS. It's very, very straightforward. If you can go back to work, then do. If you can't, then don't. Just basically stuff that you don't need government mandating what you do. You just need information available, and then you can decide what you think is the best option. That is basically the essence of the video. So there you go. Click away now. Leave a like before you go. Thanks for dropping by. For everybody else, let's get into a bit more detail. So Keir Starmer has been trying to grip the idea, and it basically just comes down to like grading a English comprehension bit of writing. That's about it as far as he's concerned from the 50-page article or the 50-page directive. So they're mentioning about wearing face masks, and it's just if you're in a closer proximity, if you're one of the 85% reduced public transport services. And just keep your 2 meter distance wherever possible, and just clean things more often. Very straightforward. So their analysis, and this is fun how even now they're still trying to push the fear from the BBC. That is still what they're trying to do. I thought they'd given up on this by trying to say that the government's overreacted and it's a terrible economic downturn. But I think now that the government is saying it's time to get back to work, they've just got to be devil's advocate and be the opposite. So they're mentioning the individual risk. How high is the individual risk? What's become clear since coronavirus emerged is that the most risk are those with vulnerabilities. You don't say. I mean, really. Any challenge, any difficulty, those most at risk or most affected by this challenge and difficulty are those with vulnerabilities, those who are not as adept, those who are inept in whatever way. Of course, they're going to struggle more and find it more difficult. And if it comes to it affecting your health, and your health is bad to begin with, then of course it's going to affect you more. Yeah, well done. So they say latest data suggests 1% of deaths in hospital in England involve people under 60 with no underlying health condition. Only 1%. Brilliant. And as we've seen before, the chances of you dying from daily life are far higher than with coronavirus, up to about the age of 50, or maybe 60 or so. So is coronavirus so bad? No, it doesn't really make any difference if you're young, and if you're like 20, especially if you're a man, because you're most risky for the lads and mainly to impress women to get those status symbols. Then no, coronavirus isn't going to be a problem. And in fact, seeing as you might be in bed and not doing anything, you're not doing those risky behaviours, in which case it could be safer for you instead of going out and about doing your regular activities. So it's actually quite good, unless you look at some prison studies where 96% of the people are asymptomatic. That is, they have it, but they're not aware they have it and they show no symptoms of it. In which case, okay, they're not being bedridden, so never mind. So they do go on to say, for the healthy population, it is clear the personal risk of dying is incredibly low, and they admit that the younger you are, the lower the risk. For the under 25, statisticians have likened it to the risk they would face from dying from several days of normal life. There is always the chance you could have an accident or suddenly die. But it is not zero, and that too can be difficult to live when we are so aware of it. Yes, but that's the same with anything, and it's an odd way to view it. Like, they liken it to saying that you're far more likely to get in a fatal car accident on the way to buying a lottery ticket than you are to actually win with that lottery ticket you buy. So it's of how you view risk and reward, I suppose, if it's worth it to you. It's that kind of thing again and again. On top of that, we see that the average age of somebody dying from coronavirus is above the life expectancy. Anyway, so you've lived longer than we expected you to, which means you're living on borrowed time, essentially. You're doing better than expected. So you're going to die of something pretty soon because you're running on extra time or borrowed time. And then coronavirus comes along. Well, I'm sorry to say, but you've got to die of something. And chances are it is a comorbidity. That is, that you have other things that you're probably going to die of within a few years anyway. So as the South African study shows, that it knocked like 2 or 3 years of people's lives instead of 10 from the poverty and the malnutrition caused by the economic effect. So it's a substantially smaller problem. And of course, when people get to that age anyway, it comes down to that a lot of the older people are then satisfied with what they've done with life, would like to be able to take the risk themselves because they're happy with where they are and what they've done. And if they've got regrets in life, there's nothing they can do about it anymore. And of course, if you want to come to terms with death, then psilocybin, LSD, having a mystical experience is a great way to come to terms with death. It's been very effective in terminal cancer patients, for example. Then have a psychedelic trip and you feel better. Apparently, that's what the studies have shown that I've seen. So it's the same here, that they then decide, well, I've done well. It is at the end of my life. I know that medical advancements are good, but it is what it is, and I'll have to die soon anyway, like we've seen with a lady before I mentioned who doesn't want to wear a ventilator. But getting back to going to school. So the obvious barrier. As Johnson said, if people don't have access to childcare and they have a child who isn't back in school, then I think that's only fair to regard that as an obvious barrier to their ability to go back to work, and I'm sure employers will agree with that. And why would you have to... I mean, I'm so against the government saying, oh, you can't homeschool, you've got to let them in to be preached our dogma and just inculcated into the cult. Well, maybe I don't want to. Well, that's a shame. That means you're an irresponsible parent and we're going to take them away from you. So, no, I don't want you to have my children. So your response is saying, I must be irresponsible, therefore you definitely should have my children. I don't think that quite works, I'm afraid. So he's mentioned again that he wants reception year 1 and year 6 back in because it's so important for the youngest children have maximum time with their teachers. Do you not think maybe the youngest children have time with their parents? Would that maybe not be better? Because for an infant to have, I believe it's somewhere between 20 and 40 hours per week without access to their parents, particularly to their mother, they have the same trauma in later life as does a child who was abandoned. It's not a lot to say 40 hours, let's say 40 hours a week then. If they're going to a nursery, they got their child minding, all that, they're away from their parents. If they're then passed along to a load of strangers who don't really care about them, they're just getting paid a small amount to make sure they don't kill themselves, that child isn't really going to grow up feeling valued or that they matter or that anything they do is important. And that is exactly what is being encouraged here. So I'm not a fan of this at all. They say into groups of no more than 15 pupils, they can't mix with other pupils, so they can't get the socialising either, which apparently is something you don't get from homeschooling. I'm still not so sure about that. Get kept 2 meters apart if possible. Not going to happen with children. Lunch at different times. If they go outside, they're not going to be running around. It's going to be a predetermined route that they follow, as we've seen in Ireland. The wearing a face mask is not recommended. Well, okay, that's something. At least then you're not going to scare the children by just hiding your face. Fair enough, as they do in some cultures. Will parents be fined if they don't send their children to school? Which, in any sensible situation, you go, well, no. No, of course not. I mean, you don't get to choose which school you go to. It's just your catchment area. It's the one that you're closest to. And maybe it's a terrible school, but that's where you're living and you can't move at the moment. So should you have to send them somewhere which is absolutely dreadful and they'll end up being worse than if they avoided it? Yes, you do actually. Otherwise you will be fined. So at the moment, we have a petition of more than 400,000 people who have signed an online petition urging the government to give parents a choice on whether they send their children back to school this term. Don't stop it at just this term, just say at any point at all. They say it is understood that parents who decide to keep their children at home will not face fines for non-attendance. And they say this temporary arrangement during the coronavirus crisis will also continue for the year groups going back to school. So that because the parents weren't ready for it, they're going to say that all the children are going to struggle in order to be able to get back on track with their education. And I was really questioned that, are you saying that the parents do not know what their children are doing at school, they're not aware of what they're being taught, and that they've forgotten so much, or what's being taught isn't important, that they can't help, and they wouldn't want to help their children do the best that they can in life? Because that seems to be what you're suggesting, that either the parents don't take interest in their children in order to know what they're being taught, and they really should, considering what is on the syllabus, especially with like sex education for 7-year-olds, but also that they either are too stupid to remember what is being taught to their children, or being taught when they were that young, or it's so useless that they don't need to know it anyway. Or they could work it out if asked because they've built upon those foundations. So be very, very straightforward. And if you're a good parent who's instilled a good work ethic into your child, then they'll want to learn anyway. So it's very, very straightforward. So the final thing to mention, coronavirus, do I have to go back to work after lockdown? Yes, you do, unless you don't want your job, in which case you can leave and work from home and try to find something else, try to do something freelance. Ideally, it'll be a free country, but that's basically it. So if you wish to self-isolate, then do so. Chances are if you do, because you're at one of the higher risk categories, you're probably retired anyway, or maybe you've just taken an early retirement because of this. If you've been furloughed, that can't be used as a subsidy for a severance pay if you're not returning back to work. But of course, the jobs that you might have had won't be available anymore because the businesses have gone bust because they haven't been able to turn a profit, which is completely understandable, in which case, no, you can't have your job back. And if there are now so few jobs compared to the amount of people looking for work because the businesses have gone under, then expect competition for your job. That is to be expected. So if you don't want to go back to your job, don't expect them to keep the place open for you. It's very, very straightforward. But there was a particular point which I find fantastic from Miss Law, from the senior advisor and conciliator at the Advisory Conciliation and Arbitration Service. There we are. And what she said to wrap up this article from the BBC and also wrap up the video, that she says employers could face allegations of discrimination if they only keep on staff who worked through the crisis, according to Miss Law. Discrimination. Yes. It's like, what are you discriminating against? We're discriminating against the people who didn't bother to work, and therefore we're just keeping the people who want to have the job and want to work, and we can help each other out. So, well, you're going to get a fine for that. It's like, hang on, I'm only keeping on the people who are actually working. Yeah. Okay. So to quote, you could find it indirectly discriminates on the basis of disability because people might be more likely to choose furlough as an option because they've got an underlying health condition, she says. Maybe that job isn't for you. Maybe if you've got a disability and you find that then you can't do the things other people can do, but you do other things significantly better because you put that time into something else, as any productive person would, then now you're in a much better position. That maybe then if you decided that the disability means I can't concentrate on academic stuff so much, then maybe you're much better at manual labor. Or if it's a physical disability, to say, I can't move around so much, then maybe you've done more intellectual stimulation. You're more a fan of reading and writing and listening and learning, in which case you'll have far better academic education and be better in the theory and ideas, in which case you've got a better head start there instead of somebody who's more balanced, because the way that it goes in any capitalist system is that those who specialize do best. So if you're actually held back in a particular way that you cannot progress there, then chances are you haven't kept trying there. Instead, you've focused on something else, and so now you're a specialist in a field because you've used your disability to your advantage. So you could easily do that. And it could be, because you've got that disability, you're then interested in other people who have a similar disability, people who have come to terms with it, what can be done in order to help them. And you could even go down your own business or be a part of a business that has that same goal and solution, and work with them in order to help out other people like you, because you're passionate about it and therefore you're willing to work harder at it than most people are. So fantastic opportunities there. But better yet, and fantastic, well done, Miss Law. What an amazing insight you have here. Or it might also be sex discrimination. I'm thinking because men are more likely to die. Because it's more likely the case, that men are likely to die from women and therefore they don't want the job because it's more likely that they're going to die than the women. Lol, no. Because it's more likely the case that it's the woman in the household that stays at home with the children. Okay. Of course, you've got to protect the women's. Might I ask then, Miss Law, in that situation, whose choice is it that the woman stays home with the children? Is it a mutual agreement that the man and the woman find that preferable? It is. So the woman would rather be with the children than have them with a stranger, and her, of course, have to be away from them at a job that she doesn't care about, and would rather have the man take care of her, and a man that she can respect because he's out earning and providing. Well, maybe the traditionalists were right about something, and maybe that's something we should look into more, because now that women can work, they basically have to work, in which case you double the labour size and therefore you devalue all the jobs, in which case it's almost impossible to get a household living on just a single stream of income. And if people prefer it this way, then maybe that's the way to go. Maybe we shouldn't be so focused on, having everybody work, and therefore we'll be getting a better GDP if the parents are away from their children, as I know the Lib Dems wanted the children to be away from the parents as much as possible, or at least that's what they were incentivizing, even if they didn't outright say it or mean it, that is what they were encouraging. And it could be actually more efficient to, instead of saying that, two people are better than one, well, not necessarily, because if both these people are not very happy with their life because they can't do what is meaningful to them, then if maybe one of them was working and the other one was supporting the person who was working, that one person would now be achieving more than both those people did before. And that's not just theory, that is actually shown through various studies throughout the decades. That is verifiably true. That essentially you've still got the two people working, but they're working in different ways in order to get the same job done a lot better than two people doing different jobs. Very, very simple idea when you put it like that. And hopefully, Miss Law, you can take that into consideration as well. So this is what people decide to do. If there's a way to make it work, then why don't we let them do that instead of trying to suggest that there's sexism at play and we've got to get more women working. What a radical thought. But hey, until next time, have a good one.